Welcome back in 106.1 ESPN Richmond. I'm Jack Fitzpatrick here on Fitz the Bill this Wednesday, September 17th morning. And we are joined now, Dr. Jose Reyes, OrthoVirginia, specializing in some sports medicine, joining us on this Wednesday morning to chat a little bit about some knee injuries, which feels like it's coming at the perfect time. Dr. Jose Reyes, thank you so much for taking some time out of your morning to join with us. How are you doing? Feels like this knee chat is coming at the perfect time with Jaden Daniels.
Good morning, Jack. Thank you for having me in your show. It's an honor to be here with you guys. Yes, it's football season, so unfortunately we start seeing some knee injuries right away. It doesn't take too long. I can share with you that in the last week I already saw teenager that got a bad injury in his knee and torn one of the ligaments inside of the knee, and he'll be out for the season.
Ooh. How do those injuries pop up? Like a knee injury, it is so common. Is it just because it's so easy to injure?
Well, if we're talking specifically about football, it's just the nature of the sport is, it's a fast speed when they're running and a lot of cutting, pivoting on the knee. Associated with the trauma sometimes that they have when they get tackled from the outside, from the inside, that put a lot of stress and forces in the knee that the knee joint is not designed for.
What sport has maybe the worst knee injuries? I feel like soccer might be up there.
Soccer has some, I'll say football probably has a little more just because the contact associated with football, you don't have it in soccer, but definitely soccer has also a good incidence of ligament tears. There are ligament inside of the knee called the ACL, the anterior cruciate ligament, that can tear, and that's a devastating injury for athletes because it requires surgery, and they'll be out, sports for 4 to 6 months sometimes. Also, they can tear a cartilage called the meniscus, and that also is a common injury in soccer. You see it also in football as well. But yes, those are common injuries that take a little while to recover from and will take the athletes out of the season.
Dr. Reyes from OrthoVirginia joining us on this Wednesday morning. You mentioned the buzzwords that I think every football fan is afraid to hear: ACL injury, meniscus injury. Jaden Daniels, quarterback of the Washington Commanders, going through some knee stuff himself. According to reports, he had the MRI last week. It came back negative, and it seems like it's just a pain tolerance thing. But from your perspective, when it comes to knee injuries in professional athletes, when it is your favorite player working through knee injuries, how worrisome is it?
It's scary. We all remember RG3, right? That was a great quarterback for now the Commanders, and he had that bad injury, torn his ACL. Depending who you ask, there were some questions that they brought him in too soon when he wasn't ready, and then he re-injured his knee. But it's a scary injury for athletes because it's the physical pain they go through, but also it affects their confidence when they go back in field. Yes, it depends on the injury itself. It's just a mild sprain. It might recover in 3-4 weeks, but if it's even a significant sprain, a high-grade sprain of a ligament inside of the knee called the MCL, it can take 12 weeks to heal. And God forbid, if you tear your ACL, it's just the nature of that injury. You lose stability in your knee for running, for pivoting. And not everybody has to have surgery for an ACL tear, but high-performance athletes, professional athletes, definitely have to have that treated surgically to restore the anatomy of the knee so they are able to play at the high level they're used to. So definitely it's a serious condition, especially when you tear the ACL ligament. And every athlete fears that because the time that will take to return them to play.
So with Jaden Daniels, or just kind of in general with professional athletes or athletes in and of itself, when they are playing through something like a sprain or something along those lines, is there a higher risk for injury at that point?
Well, it depends on the degree. If they are having a mild sprain and they are rehabbing at the same time, and they are using braces to protect their knee, there might be a slight increase of injury for that. However, the professional athletes teams they have a very, very good medical team that assess them, and they have them practice and see how much they can do. And if they feel like they are not ready and they are, taking a higher risk of injuring the athlete further, they usually hold them back until they're ready to resume.
Dr. Reyes from OrthoVirginia joining us this Wednesday morning. Doctor, how do you go about examining a knee injury in and of itself? When they first come in, how do you assess everything? Is it immediately an MRI like we hear with NFL players? It feels like they're always getting these MRIs. What's the process in examining a knee injury?
Well, not necessarily. I think the scenario is different because professional athletes that they are very expensive, athletes. So we want to know right away, but for regular human beings like us, it doesn't work necessarily like that. Sometimes it is required to order an MRI right away, but the majority of the time it is not. We examine the knee based, observation is the first step. You just look at the patient's leg and joint, see how much is well and bruising there is. Then we go with palpation and start putting pressure and examining the areas where patients might have more severe tenderness, because that gives us an idea. Is that a medial meniscus, the meniscus in the inside, the meniscus in the outside? Did the patient broke a bone in the kneecap that we call the patella? And then we do some specific maneuvers to check ligaments stability, also to check the meniscus. And we assess range of motion, how much mobility the patient's joint have, because you should have normal mobility if it's not a serious injury. And also we assess patient's gait. We see the patient walking and see, is the patient limping? Is the patient able to walk normally? And even further, if the patients are walking normal, but they still have a little discomfort, sometimes we have them jog a little bit in the office to see what happened when we put a little more load in the joint, a little more impact. Is the patient, the athlete, able to tolerate that or not? And, based on the exam that we do, also the way the knee feels as well, and lack of mobility associated, accompanied with x-rays findings, we make decisions. Do you need to be in a brace? Go and work with physical therapy. That's a very common intervention to help patients to recover. Or is there a need to obtain further images like an MRI? Because if you highly suspecting that a patient torn an ACL, probably it's a good idea to get the MRI sooner than later, but it's very important to restore the motion of the patient. So therapy is very important along with the MRI at the beginning of the treatment.
Are all ACL tears created the same? Because the reason I asked, JMU football, they have a quarterback, Alonzo Barnett. He tore his ACL November 30th, and he was back starting for JMU football the following season, week 1, 9 months to the day since he tore his ACL. And that just blows my mind, right? Because you hear about ACLs, it takes a year to recover. Are all ACL tears, ACL tears, are they all created kind of equally, or are they different severities to tears?
Definitely there could be different severities to tear. Like you could have a partial tear versus a full tear. Some patients could have a little sprain. The problem is that when you have even a partial tear that takes more than 50, 60% of a tendon, the ACL we know doesn't heal well. Difference that the PCL, the posterior cruciate ligament, if you have an injury where the PCL is the only ligament injured, what we call an isolated PCL injury, we know that ligament healed very well and will resist load and mobility without providing instability. The ACL is not like that, and it's just the biomechanics of the knee and the forces that ligament tolerates. But to answer your question, when you analyze, because there have been millions of studies on biomechanics and, 3D models comparing what happened in the momentum of the knee when athletes tear the ACL. And normally is a combination of planted your foot, some component of rotation to the inside, and there is a momentum where we call the knee going valgus, where patients see my knee buckles to the inside. Right. And then that particular motion of the knee buckling to the inside with a component of rotation produce ACL tears. So females compared with males, because the way our quadricep and hamstrings ratio is, females are more prone to tear ACLs than males. So basketball is a big injury, is a big sport for females tearing the ACL. So we focus very much in squatting, one leg squatting, and do a vertical squat without letting your knee to collapse to the inside, because that's the killer motion.
That's interesting. That's really interesting. What are some knee injury prevention strategies that you recommend for athletes when just so they can avoid getting a season-ending one?
Definitely strengthening is a big thing. Strengthening your quadricep muscle, hamstrings muscle, calf muscles, and your core, the muscles around your belly, along with your hips. That is very important. It's very important to work on flexibility, joint motion. It's important to work on balance. Outside of football, the FIFA many years ago created a program called FIFA 11 Plus. That was a program to decrease a ratio of injuries in soccer around the world. And it wasn't just knee injuries, it was hamstring tears, hip flexors. But due to this prevention and combination of exercises, stretches, conditioning, they decreased the ratio of injuries around the lower extremity by 80%. That was huge.
Wow.
So definitely a combination of strengthening, mobility, and balance. That's what you really want, and master that, squatting position with your knees straight going down, avoiding that collapse to the inside. That's very important in prevention.
Dr. Reyes, where can listeners go to schedule an appointment with OrthoVirginia if they have knee injuries, if they have knee concerns, whether they're an athlete or if they're not an athlete?
Well, in our high-tech world that we live, OrthoVirginia.com will guide you in different paths. Depends where you are. Are you in the central region, Richmond, or in Northern Virginia, Lynchburg? We also have some orthopedic urgent cares called Ortho on Call that are associated to OrthoVirginia. But if you go on OrthoVirginia.com, you will get phone numbers and different ways to schedule appointments online.
Awesome. Appreciate the time so much. Have a great rest of your Wednesday. Thank you so much for carving out some time for us.
Thank you, Jack, for having me in your show. I really appreciate it. Thank you.
Of course.
It was an honor.
Of course. There goes Dr. Jose Reyes from OrthoVirginia joining us this morning to chat a little bit about some knee injuries and other things that occur in athletes. Appreciate him taking some of his time out of his morning to chat with us. All right, let's get our last break in here, set you up and bring it to news or snooze as we continue on with Fitz the Bill on this Wednesday morning.